My name's Mark Latimer, and I'm a consultant orthopaedic surgeon. I work at Addenbrooke's Hospital, which is Cambridge University Teaching Hospital in Cambridge. I'm a doctor because I'm the son of a doctor, and I spent a lot of time in the company of my father and his friends, and all of them thoroughly enjoyed what they were doing, and I found that very attractive. Well, I actually did a degree in engineering before I did medicine, and I specialised in mechanical engineering, and paediatric orthopaedics has a great deal of synergy with engineering. It's a lot of what we do is getting the mechanics of the skeleton right, and so those are very synergistic specialties. I was born in London. I spent the first few years of my life in Nigeria, where my father was working as a doctor, and then settled in Cambridge, and sort of on and off I've been in Cambridge ever since. The most rewarding thing that I find about my job is that it is very effective in solving problems, and it is usually fairly rapid in solving problems. Children come with a broken arm, you fix it, and they go away with an arm that works again. Children come with dislocated or malaligned legs, and you fix it, and they go away better. And that sort of that rapid accountability and effective outcome I find highly satisfying. I have quite a lot of feedback telling me that I'm easy to talk to, that I communicate well with children and communicate in a way which is accessible and hopefully not too technical. That's largely the feedback I get. Well, children's orthopaedic surgery is high stakes, because decisions that you make in children and treatments that you provide in children often have effects which last their whole lifetimes. And so considering carefully the diagnosis and the treatment options, communicating clearly with parents, but also wherever possible with children, is part of the challenge, but of course also part of the reward when one gets it right. I think one always has to just take a deep breath, think about other people's perspective, and be reflective to often the stressful situation that other people find themselves in, and be accommodating and conciliatory. So three objectives that I would regard as central to paediatric orthopaedics would be, firstly, communicating well with parents and children, identifying the problem. Secondly, actually communicating well with parents and children in order to consider all the various options to correct the problem. And then, of course, thirdly, and perhaps in the end, most importantly, operating or treating a child in a way which achieves an effective and successful outcome.